Hi, my name is Sue, and I'm one of the childbirth educators here at Holy Redeemer. Today in the childbirth education series, we're going to be discussing variations of labor. So we had said in a previous class that the average length of labor for the first time mom is about 12 to 24 hours. And I frequently get asked from moms, okay, how can I get closer to 12 hours than the 24 hours? Unfortunately, there's a lot of variation, and that depends on some things that may or may not be out of your control. So for the first thing that may or may not be in your control is the size and fit of the baby in your pelvis. And if you look to my poster here, this is considered the normal position of the baby in your pelvis. So notice this is basically your backbone, your spine right here, and the baby's looking at the spine. When the baby's in this position, called the posterior position, the baby's head is aligned with your spine. The baby doesn't fit quite as well into your pelvis in this position. So, and it also depends on how big or small your baby is and how the baby fits into the pelvis. So it depends a little bit on your passenger, how much weight they have and how they're fitting into the structures that they're trying to accommodate. Keep in mind, the baby has to do many twists and a series of rotations to negotiate the bones of your body or the pelvis. So we come back to the pelvis here. And many times the baby starts out in one position and then will change to another position. So typically the babies are kind of bunched up in a little bit of a ball, and they twist and they rotate out of the birth canal. And again, that really depends on your body, how easy or hard it is for the baby to make its way out. The size of your pelvis may have something to do with how the baby fits too, which is not in your control. Your pelvis is what was given to you at the time of birth, and it grew according to your size. The force of contractions. So again, we had said in a previous class that the uterus is the muscle in your body that houses the baby, that squeezes the baby down the birth canal and out of your body. For some women, they come into the hospital, their contractions are close, they're long and they're strong. They get to the hospital, they get into their hospital bed, and the mom goes, I don't have my contractions, I'm not feeling them anymore. They kind of go away, or they're not as frequent, or they're not as strong. So without the force of contractions, it's going to be very difficult for your baby to get out of your body. The other thing is how ready your body is to go into labor. And for many women, we give you a due date, and many ladies say, oh, that's when my baby's going to come. But in actuality, it may be a week early or a week later than that due date. It's the best estimation that your doctor has about when your anticipated arrival is going to occur. So it may or may not happen on that date, and it may be around or close to it. But if you're not experiencing any contractions, your cervix is still closed and hasn't started to open or thin, then your body isn't as ready as it needs to be for labor to occur. So different things can occur, with regards to the labor itself. And so most women, if I took a poll, and said, who would like a long labor? Everybody would be like, not me, don't want it, don't sign me up for that one. That sounds like a lot of work. And that person would be right, because that's usually a labor that's longer than 24 hours. So that labor can go on for a day or so, and that is very taxing on mom's body. And so long labors can be extremely frustrating, not just to mom, but to her support person and to their families as well too. I hear frequently from my patient in labor, it's my mom calling again. She wants to know why I haven't delivered the baby yet. We're working on it. It's usually what I tell the mom, have patience, the baby will be delivered. This can't go on for an undetermined amount of time. Typically it's a day or two, and then we have to make some types of decisions about how the baby will be delivered. And then I say, who would like a short labor? And everybody in my class, all my moms, hands go up, oh, give me that. But let's talk about what it is before you say you want that. So the short labor is usually less than 4 hours. So that's everything that we talked about previously: the beginning, the middle, and the end, and the pushing phase of your labor squished into 4 hours. So the transition that occurs between those different parts of your labor occurs very quickly. Many women have decided ahead of time, what it is that they would like to use to help them with pain management. You may not be eligible for something if you're moving that quickly through the different phases and stages of your labor. There might not be time to safely administer pain medication. And so while the short labor sounds really good because it's short, it's a very, very, very intense type of an experience. And so short labors sound really good. But again, if you're not the kind of person who can kind of sort of roll with everything, it might not meet the expectation that you have for your labor. Some women experience that back pain, and women in pregnancy sometimes experience back pain as well too. But specifically in labor, it has to do with that posterior position, the position shown here on the poster. That puts a lot of extra force on this bone right here. As the baby gets into position, they push really hard on this bone. And so you think, well, what the heck can you do about back labor? That's just the way the baby is positioned in your body. Interestingly enough, there's something that we have tried that is really helpful to people. So the baby's pushing on this side of your spine. What we usually recommend, the nurse will do and show your support person, is to use something called counter pressure. So whether that's using the heel of your hand to push on the mom's spine where she says that she's feeling intense pain, or you use a tennis ball, which again, we don't have them in the hospital, but you can bring a tennis ball with you to use to push on the back. And it's interesting to note, no matter how hard you push, mom almost always says, oh, push harder, push harder. So you feel like your hand's gonna go through their body, and in actuality, it's just the counter pressure. So the idea is physics, equal and opposite pressure kind of nullifies what the mom is feeling. So the baby's pushing here, I'm pushing here, and it kind of neutralizes the mom's back pain a little bit to make it more tolerable. Different positions can be used in labor. A lot of times the traditional positions that a lot of people see are, mom is in bed, maybe she's sitting up, maybe she's laying down on her side, and certainly that's perfectly fine. But if you're healthy and well, the baby's healthy and well, maybe you can sit in a rocking chair, or maybe you can sit on the sofa, or maybe you can do a little bit of walking around in the room if you would like. All these changes in position help your baby to change, because again, when you turn, the baby has to move with you. When you turn the opposite way, the baby also has to move with you. When you stand up, when you lay down, when you squat down, or when you sit up, the baby changes its position as well. So we highly encourage as many position changes as you can tolerate in your labor to keep the baby moving. That movement will continue to be all the way down the birth canal and allow the baby to exit a little teeny bit faster. So seeing as much as you can, if you want a little bit of a shorter labor, that closer to 12 hour than 24 if you're a first time mom, try to keep moving as much as you can. The last thing I wanted to talk about is we had talked about the due date, and everybody says, okay, well, the due date comes, the due date goes, I don't feel contractions, my bag of waters haven't broken, I don't feel like I'm ready to deliver the baby. What's going to happen now? So typically the doctors usually make the decision at some point after your due date to say, we're going to schedule something called an induction of labor. So the induction of labor can be done in different ways. The most popular way most of our physicians use is two different ways. So the first way is where we use a softening agent for your cervix. So if you're a first-time mom and your cervix is long, thick, and closed, there's no point in having contractions for a cervix that's that tight as a drum. We need to soften it up. We need to do what your body would have done to prepare your body for labor. So the first thing that has to happen for a first-time mom, I had said in previous classes, is, just like blowing that bit of bubble gum to make a bubble, you've got to thin out your bubble gum before you can open it up. Same premise with the cervix. We've got to make sure that our cervix is pliable and soft before the contractions come to really dilate and open the cervix. So many times the doctors will take extra time, which makes it sound like your labor is going to be even longer, but in actuality, most women are quite comfortable, maybe having some cramps. If they use a softening agent on the cervix, it usually takes about 12 to 24 hours to soften up the cervix. You have to be in the hospital during that time. After that, they'll use a medication called Pitocin or oxytocin. Women's bodies make their own oxytocin. It's a hormone in your body. And at the time of labor, usually you kick in some. Occasionally, we need to give you some through your IV. And the goal of using that medication through your IV is that we want your contractions to be about 2 to 3 minutes apart, lasting about 1 minute, and be pretty intense as far as the contraction itself goes. So we don't know how much of this medication each person is going to need. Each person needs a little bit different amount. It doesn't go by your height, it doesn't go by your weight, it just goes by how your body absorbs the medication and how your cervix responds. So approximately every half hour or so, we will increase slowly the medication. So it's run on an IV pump, it goes through an IV. So when you think about your expectations for your labor, for your delivery, some things are in your control, some things are out of your control. It's important to understand for everything that we need to do when you're in the hospital, there is potentially an outcome, a good outcome and a bad outcome. So it's really important, and we'll get into this when we talk in our next class about pain management and pain relief. What kinds of things should you know before you agree to something we suggest to do? There's a little bit higher percentage that if we use Pitocin, that you may need to have a cesarean. Not everybody's body responds to that medication in a favorable way. Not every baby responds to a labor using Pitocin in the same way too. So the induction is one option. Something else called augmentation is another. Augmentation is when you're having contractions, they're just not really doing anything for your cervix. So, there's slow progress being made. We check your cervix periodically, and we don't really see a whole lot of movement because your contractions are too far apart. We need them to get closer together, more in the middle stage of labor. So we could use the medication Pitocin to augment or to continue to stimulate your labor to get closer, longer, stronger contractions to occur. I hope this information has been helpful to you. I look forward to seeing you in the next series when we talk about pain and pain management. Thank you again for choosing Holy Redeemer.